Hi, my name is Adriana. I'm a physician assistant student and I'm currently in my clinical year. I wanted to make this video. It's my first video, hopefully just to help other students who are kind of nervous and not really sure what to expect going into their clinical rotations. I was looking for more specific videos and I was only able to find about like 4 or 5, so there really aren't that many, so I just wanted to keep expanding kind of the resources out there for students in PA school. All right, so what I'm gonna do in this video is I'm just gonna talk about my experience in my rotation, which it was my first one. It is a 4-week rotation, and then I had a week of callback this week. And then I'm going to go into my top diagnoses and things I think you should refresh on prior to starting your rotation if you're doing internal medicine, which was my first rotation, and just general tips to be successful on your EOR and in your rotation. Right, so like I said, my first rotation was internal medicine. I was in an inpatient setting, and I was in a very large teaching hospital in a large city. So I did have overnights. My shifts were a little rough. I was there Mondays, Tuesdays, then I went back to the hospital Friday, Saturday, Sunday, and then I went back the next week, Wednesday, Thursday, and I did that same schedule again for the next 2 weeks. And they were all overnight shifts starting at 9:30 p.m. So when I got to the hospital, there were other students there. They were medical students, not from my school, but from a different school. And we would all get assigned a patient. We would do some pre-charting on them, and then we would go see the patient, do a physical and history taking on them. Then we would go ahead and write a SOAP note. And once we finished doing the SOAP note, then we went and presented to our preceptor. This part was incredible, and I'm really grateful for the experience that I got doing this, because I was able to hear the other students' cases and then also discuss my case. And my preceptor was great. He is a bundle, like a wealth of information. He could literally just tell you everything that was on Up to Date. So we would go discuss each case, present it for about 2 minutes, and then we'd go over the diagnoses. We would talk about what the commonly presenting symptoms are for that. Then we would talk about any specific diagnostic imaging or labs that you should do for that specific disease. And then we would, after that, talk about the treatment, which was kind of like the most, I guess, in-depth part of the conversation. And then if we had any questions, we could ask questions. Once that was finished, the medical students were able to leave. I myself had to stay there and go ahead and round on some more patients after that. I would do the same exact thing just by myself, and then instead of presenting to my preceptor, I would just send it off to him. And then after all of that, writing SOAP notes for each patient I was seeing, and I was using Up to Date, looking at the treatments. I spent a lot of time doing this, and that really helped me for my EOR. So I would definitely recommend after each patient you see, look up maybe on your PANCE Prep Pearls, go ahead and look up the whatever case it was, and also on Up to Date. That helped me a lot for my EOR. And then I would go with my preceptor, and then we would round those same patients. And once we finished rounding them, I was able to ask any questions at the end of the night. So I did have a couple of assignments outside of my rotation, which was to look up general things, like he wanted me one time to look up hyperkalemia on Up to Date and just write a short report on it. So that was really helpful. Everything that I did really helped me, I think, for my end of rotation exam. So I really enjoyed that rotation. And even though the hours were a little hard, that I really did have a good experience doing it. So moving on to the next part. This part actually was one of the main reasons why I wanted to film this video. I really could not find a good video talking about the top diagnoses that they've seen. And again, this is specific to internal medicine inpatient. And again, based on the demographics, like wherever location you're rotating in, it's going to be slightly different, but I think it's pretty across the board should be similar. So my number one was unfortunately alcohol and drug intoxication and withdrawal. I would say my number 2 would after that be DKA from just uncontrolled diabetes. This population that I was seeing, there was a lot of just like social health issues. So a lot of the patients unfortunately didn't have access to their insulin, so that was a big cause of leading to them being in DKA. I would say the third thing, it was congestive heart failure, specifically acute exacerbation. Then I would say number 4 would be just septic shock. And number 5, DVT. I know other students also said pneumonia, and I would say also just a general like dizziness complaint, like syncope. So, and a lot of that was due to just volume depletion. I would say most of the patients had that complaint because of volume depletion, just not being well hydrated, maybe from other causes. So those are the top things I would say I did see specifically. There are other things that I think you should review too, just knowing how to read a CBC, a CMP, and urinalysis, know how to look at labs and understand what's going on with the patient, because when I was pre-charting, that was a big thing, and I had to sit there for a while looking up what everything meant and why the patient had those specific like elevations or decreases on their labs. So definitely be comfortable looking at labs. And knowing just, I would say, electrolyte abnormalities in general, like your hyperkalemia, hypokalemia, hypernatremia, hyponatremia, things like that. So that's it for the kind of like top diagnoses and things I think you should review, and just general tips overall, how I studied for my EOR, and just how to be successful doing that. I listened to a Stephanie V's YouTube video like a couple days before I took my EOR, and I typed out notes. Prior to doing that, I was during whenever I had downtime on rotation, I would do a couple of the Endeavor Anki deck cards. I didn't get through the whole deck, honestly, gonna be transparent. It's a lot, there's like over 2,000 flashcards, but I did make sure I got through the main top 4, which are going to be your cardio, pulmonology, GI, and ortho room. So I made sure I got through those cards on the Endeavor deck. And anything I didn't get through on the Endeavor deck, I would go ahead and make flashcards based off just Smarty Pants. I have a subscription to that. I really recommend using it. There's probably Quizlets out there that have Smarty Pants flashcards on them that you can access for free. And I really recommend using that. It's so brief. What it is, it gives you a scenario, so it'll give you how the patient presents, which is really helpful. Then it'll tell you common symptoms, any pertinent diagnostic testing, and the treatments. And sometimes, of course, it'll say like risk factors if it's relevant to that, or anything specific, like for cancers, it'll say like, for example, it'll say like risk factors, what the prognosis is. So it just gives you that very like short, brief synopsis of the things that you have to know for each of the topics based off the PAEA's topic list. So those are the resources that I use, and I think that helped me be successful in my EOR. I hope this video helped you. I wanted to keep it really brief. I know we're busy studying, so hopefully it helped you kind of get a feel for what it'll be like, ease some nerves, because I know I was very nervous for my first rotation, especially because I didn't know a whole lot. My program didn't tell me a whole lot, and I just didn't know what to expect. So hopefully this helps ease your nerves if you're in that situation. And good luck studying. I hope you all do really well in your clinical rotations. And if this video is helpful, comment below, and I'll make another one for my next rotation, which is going to be trauma surgery at the same hospital that I was in before. And if you are in your didactic year, good luck studying. And if you're pre-PA, just kind of wondering what it's like to be a PA student, hopefully this video helped you as well. All right, take care. Good luck.